Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, I gotta ask, what is with the red, or no, that's green.
Yeah.
Green stripe on your pants.
What's wrong with the vision, Bob?
With the vision,
Yeah, that is a piece of duct tape, Bob.
All right.
Yep, and it's green because I like to watch the red-green show. Actually,
Very
I'm just
good.
kidding. We're going to talk about how to negotiate up and down steps and how to strengthen that involved leg. This is the leg that actually had the knee surgery.
After a knee replacement.
Total knee replacement, and the muscles are weak and you're having a hard time getting up and down steps.
Just to recap real quickly, after you've had a knee replacement, generally you're taught to go up with the good leg first and down with the bad leg first. Up with the good, down with the bad. Going up to heaven, you lead with the good leg. Going down to hell, you lead with the bad leg. Now this is beyond that. Now you want to start walking normally, step over step, right?
Right, yep.
So you got to strengthen that leg so it can handle you.
You bet.
But you got to do it in a safe manner.
Exactly.
All right, so Brad's going to show us how to do that.
Good.
All right.
Okay, actually I'm working with two people in the clinic right now with this very question. I'm just about ready to discharge them, and they want to be able to go up step over step just like they used to. And obviously there's two strengthening exercises I think get to this the easiest, and they can be done at home easily, and this is exactly what my patients are doing. Okay, the first one, you're going to go up to your countertop. Obviously this is the countertop, but it's about this level, and where you have the sink. Okay, if the sink is right here, you're going to put your hands over the sink so you have a ledge where my fingers are wrapping around there. That way you're stable. Okay, and we're simply going to do squats. Okay, Bob, come over here once.
Sure.
Oh, I mean, with you got me on there?
Oh,
Center?
yeah, I thought you wanted me.
Well, it looks like you're pointing over there.
I got you.
I want to be the center of attention, Bob. Okay.
You see it?
Here we go. So we're just going to do squats. Okay. Now, common errors that people do with the mechanics of the squat, they'll start doing this. Okay, and that is not going to help that leg. We need to have good posture, shoulders back, and then go back with the weight slightly on your heels. If you feel like you're tipping backwards, you need to have weight forward so you feel very confident, safe, and balanced. And you're going to work squats. You're going to do 10 to 15 of them. I like to have people put a chair behind them so when they're tired they can just sit down.
That's a good idea.
Okay, so that's the first exercise, 10 to 15 of these, 2 to 3 times per day. The next one, and this directly relates right to negotiating up those stairs. Okay, again, green tape, that's the knee that's weak from the surgery, that's the new knee, and we always say up with the good, there, like that, and that's always easy because a strong leg is lifting your body weight. Now, this is harder. People do all kinds of compensations to do it, body swinging around and whatnot. You want to keep good posture, shoulders up. It's a good idea to use a cane. Cane on one side, and hand on the cupboard, and I have a 4-inch block here. The other option is if you have a stairwell and you have handrails, 2 handrails is even better. Just go to the first step. You're going to lift yourself up with that new knee and then go back down. You'll find usually going up is easier, going back down is a little bit harder, sometimes hurts a little bit. You need to work through that a little bit and try to get a set of 10. Here and down. I'm going to get the cane out of the way so you can see. Up.
And you certainly can be holding on to the rail the whole time.
You bet.
Yeah.
Safety is first on this.
If you even have one rail, you're probably safe on doing this. What you said, right?
Yeah, again, this is for people higher level.
Right.
You're pretty much done with your rehab. You're walking outside on the grass safely and comfortably with a cane, and maybe even without. Final stages of knee strengthening for going up and down those steps. Works great, and it might take you, you got to be patient. You need to work on this for a couple, 3 weeks sometimes, but you will get it, and you'll get stronger as the day goes on.
It's just a general good overall strengthening for the total knee after it's
You
been
can
replaced.
come in, Bob. You don't have to stand back there.
All right, thanks for letting me back in.
All right, Bob, what kind of people are going to watch our video?
All right, if you're 40 and over, you're going to want to subscribe to us because we're going to show you how to exercise, how to stay healthy, fit, and strong, and pain-free, and help you after surgery.
But wait, Bob.
There's more.
What about those Vikings? I got it.
All right. See you later. Well, you've been holding on to that one, haven't you?